So let's talk about treating all these incontinent things. How do you treat them? Well, the very first thing that I do with my patients is I have them complete a 3-day bladder diary. This is the most important piece of information that you can give me. If you don't say one word to me, if you fill out the bladder diary correctly, I can know more about your bladder than you ever wanted to know. Because what it tells me is, when you go, how much you went, did you have the urge to go, did you leak, and then I want to know everything that you drank and what time did you drink. Because a lot of times, what we don't realize is what we drink can cause us to have urgency too. One of the other things we do is look at your fluids. We look at what you're drinking because there are irritative foods and fluids that can cause urgency. If you get rid of that, you get rid of the urgency. And those are caffeine, unfortunately, lots of citrus fruits and drinks, grapefruit juice. And that's one thing. You can deal with everything else, but I tell my patients no more grapefruit. You know, if you want to treat yourself on Sunday morning, fine, but don't have grapefruit every day. It's not really a good thing to have. And real spicy foods, all those things can cause problems with urgency. So we look at what you're drinking and then we try to decrease that as well. The other thing is, when I examine all my patients and I make sure that their pelvic floor muscles are strong. And if their pelvic floor muscles are not strong and they're weak, then that's going to be a problem that they're leaking as well. So I teach everybody Kegel exercises. So everybody here is going to learn how to do Kegel exercises, okay? So I want you to sit in your chair and relax, all right? Now, what I want you to do is, it's very important that you isolate the muscle that's your crotch, basically. The muscle in between your inner thighs, okay? That stretches between your vagina and your rectum, and for you gentlemen, stretches from the base of your penis or your scrotum back to your rectum, okay? Now, what I want you to do is, I want you to take a big deep breath, and let it out, and then I want you to squeeze that muscle, but before you squeeze the muscle, no movement on the belly. So everybody put their hand on their stomach and see if you can isolate that muscle and squeeze it, and I want you to squeeze it and hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So how'd you do? Not so good, huh? No, when you first start doing that, you know, the most important thing, number 1, is isolating the muscle. Number 2 is practice so that you can get up to 10. That's going to be the goal. I can go up to 10 because I do it every single day with my patients. Now, for the gentleman, to know if you're doing it right, when you squeeze, you should feel the tip of your penis rise just a little bit. And if that happens, then you're doing your Kegel correctly. But don't squeeze like this. No belly action. Because just think, if you're pressing your belly right against your bladder, then what happens? Oops! You don't want to look and see what's under that chair when you get up. So it's really important that you do your Kegel exercises correctly. Because Kegel exercises are not only good for stress incontinence, but with urgency, they're good because we teach people to do what we call urge reduction techniques. And that is, okay, if any of you had to go to the bathroom right now, the most important thing that you can do is just take a big deep breath, let it out, and do a couple quick Kegels. Squeeze, rest, squeeze, rest. And that, you try to distract yourself, and that should take the urge away. And that really works. You have to practice it. You have to do your Kegels correctly, but it will work. The other treatment that we do for urge incontinence is medication. And there are 7 different medications on the market right now. There is a patch, There is a gel, and all the rest are oral medications. Some you have to take 3 times a day and can cause lots of side effects. Some you take once a day and have fewer side effects. But the most common side effects from all of these medications is dry mouth and constipation. 2 things that you already have from all the other meds that you're taking, so that's the one thing that I try to do is stay away from giving any of those medications. Some of the other treatments that we haven't talked about are going to the bathroom regularly. Now it's important that you do toilet yourself every 2 to 3 hours with or without the urge to go. Because like I said earlier, you may find that you're going to get that urge and you're going to have to go right then. And there might be a door jam, there might be somebody already in the bathroom, there might be something that's holding you from getting there and you're not going to make it. So it's really, really important. I'm not an advocate of women wearing pads. So whether that's your goal, that's my goal the minute you step into my clinic. Because for lots of reasons. 1, it gives you permission to leak. 2, it can cause chafing and dryness and yeast around your vagina and your labia, can cause lots of problems in skin that gets broken down, and that then becomes another problem. And so I'm not an advocate of pads. I think they're great for training and trying to get your problem under control, but otherwise I think that they're not good. But I do say when people go out, definitely wear one if you feel more comfortable doing that. Some of the other treatments that are available, of course, are surgery. Surgery is only available for stress incontinence. But there's 2 different kinds of stress incontinence, 2 different kinds of surgery, which is important to know because one surgery, if we remember that sphincter that I told you about that's at the base of the bladder, sometimes that gapes open. And it's supposed to always be closed like a kaleidoscope. Remember those things when we were younger that you could open and close? That's how your bladder sphincter does, okay? If that doesn't close all the way, what happens is you're going to leak as you walk around. So how we know that is we do what we call urodynamics. It's a diagnostic test that we do in the clinic to see if that's your problem or not. Or the urologist will do a cystoscopy so that he can look inside to see if when you close that cystoscope out that your sphincter closes. So if that doesn't close, we can do what we call bulking. It's a procedure that we do right in the office, and we numb everything up, and we just use a long needle, and we bulk each side so that it doesn't hurt. Honestly, it sounds like it hurts, but I've never had anybody jump, move, run away, scream, or anything. So we do a very good job of numbing it up anyway. And that helps instantaneously. That is something that has to be repeated every couple of years, but nonetheless, that's the only treatment for that type of incontinence. The other kind of incontinence that you have is can be treated by what we call a sling, and it's just a piece of tape that lifts the bladder up. Okay, and it supports that bladder neck so that you don't urinate or that you don't get